Okay, so hello everyone. My name is Sophie von Teichman and I will be your monitor for today's session. I am a research assistant at McMaster University and I have long blonde hair and I'm wearing a light pink sweater. I am absolutely thrilled to welcome you all to today's parallel session on diverse work arrangements and the impact on people with disabilities. To give you a bit of background about what we're going to discuss today, we're going to go through two scoping reviews that we are currently working on, followed by a parallel discussion to talk about work options for people with disabilities. To close things off, we'll be running a question and answer session. And a brief housekeeping note about the question and answer session, you will see on your Zoom screen a question and answer box. Please type your question in that box, which will then be monitored and moderated during the Q&A session. You may also raise your hand in Zoom during the Q&A and we will unmute you and you can ask your question out loud. If you have any pressing questions during the sessions, we will do our best to monitor it in a written response as we go. Following the presentation and the Q&A, there will be a networking session from 2:05 to 2:25, specifically designed as an opportunity for delegates to join and discuss, to share ideas and thoughts about the presentation. So before we jump into what we've all come here for, I'm going to invite our panelists to introduce themselves to you, and we will start with Christina.
Hi, everyone. My name is Cristina Fuentes, and I'm a postdoctoral researcher in the Bloorview Research Institute at the Holland Bloorview Kids Rehabilitation Hospital. I have white skin, brown hair up in a ponytail, and I'm wearing a black turtleneck sweater.
Thank you, Christina. And we'll go to Julia now.
Hi, everyone. I'm Julia Holmes. I'm an occupational therapist and a research coordinator with the Inclusive Design for Employment Access Social Innovation Lab at McMaster University. I have dark brown hair, white skin, and I'm wearing a black sweater today.
Thank you, Julia. And now we will hear from Upasana.
Hi, everyone. This is Upasana. So I am currently doing my master's at McMaster University, as well as working as a research assistant in a couple projects at McMaster as well. I am currently wearing glasses, white spectacles, and I have dark colored long hair, and I'm wearing a black blazer. Thank you.
Thank you so much. And we will go to Mahadio.
Good afternoon and good morning, everybody. My name is Dr. Mahadio Sukai. I am the Vice President Research and International Affairs and Chief Accessibility Officer for the Canadian National Institute for the Blind, or CNIB. I am a brown-skinned man with dark hair and thick glasses, wearing a navy blue suit with a yellow shirt.
Thank you so much. And finally, I will invite Rebecca to introduce herself.
Hi, my name is Rebecca Gevirtz. I'm an associate professor at McMaster University. I'm excited to be here today, and I have blonde hair, white skin, and I'm wearing an off-white sweater today.
Perfect. Thank you so much to all of our panelists and presenters. With that being said, we can jump right into the first scoping review. So I'm going to invite Christina to take the floor and present.
So today I'm going to be talking about some of the findings from our scoping review on workplace accommodations during the COVID-19 pandemic and the impacts and implications for people with disabilities. So the co-author on this paper, which has actually just recently been published, is Dr. Sally Lindsay. So the onset of the COVID-19 pandemic in early 2020 led to widespread changes in the way many people work, and most of you are probably quite familiar with these by now. So they included an increase in remote working arrangements, increased use of digital technologies, and more flexible hours. Now, prior to the pandemic, these same modifications were among the most prevalent workplace accommodations sought by people with disabilities, often without success. Now, when the pandemic was declared, these accommodations were quite suddenly and widely granted almost by default. So our review examined the literature on workplace accommodations in the pandemic with the aim of understanding their impacts and their implications for people with disabilities. Now, previously published reviews have examined pandemic-related changes to the world of work, but no reviews that we are aware of have focused on their impacts on people with disabilities. And actually, quite a few of the reviews that we found explicitly excluded studies that focused on people with disabilities. So we approached this review from both the clinical and rehabilitation perspective and also a policy perspective. But I will be focusing a little bit more on the policy side of things today. So we chose to do a scoping review because this type of review is usually best suited to addressing exploratory research questions on a novel topic or an emerging field. For this review, an electronic search of 6 international databases was conducted covering the period of December 2019 to December 2021. The search strategy included a range of keywords to capture the different ways that workplace accommodations are described in literature and to capture international variation in terminology. So, for example, in the UK, the language that's used in legal and policy documents is usually workplace adjustment. In terms of inclusion criteria, articles had to be published in a peer-reviewed journal and had to explicitly address both work-related changes during the pandemic and the impact on people with disabilities. Now, given the exploratory nature of this review, we wanted to capture as wide a range of findings, ideas, and perspectives as possible. So we included any type of peer-reviewed publication in addition to empirical research studies, such as commentaries, editorials, and also opinion papers. And altogether, 1,991 titles were identified through our search. Following the screening process, we were left with 37 studies meeting the inclusion criteria. It is worth noting that one of the most common reasons for excluding studies at the screening stages was that they focused on workplace changes in the pandemic, but there was no discussion whatsoever of people with disabilities. So geographically, 10 different countries were represented in 34 of the included studies, and then 3 studies had a global or a multi-country focus. The studies used a range of methodologies and approaches. So the majority of the articles, 26 of them were qualitative, 6 were quantitative, and 5 used mixed methods. So in terms of the methods, 13 articles were based on secondary analysis and 12 were primary research studies. The remaining 12 of the papers were perspective papers, so opinions, editorials, and so on. So our review identified 3 main themes. We used thematic analysis, and I'm going to discuss these mainly in relation to working from home, but it should be noted that some of the studies looked at various adjustments that were made to workspaces and other pandemic-specific accommodations that were provided for workers who were working on-site. Nonetheless, the main focus, I would say, for many of these studies was remote work, and so that will be the focus here in this presentation. So the first theme was the positive or potential positive impacts of pandemic-related workplace accommodations on people with disabilities, which included improved accessibility, rapid implementation, reduced stigma around accommodations, and opportunity for advocacy. So I'm just going to discuss 2 of the sub-themes here, reduced stigma and opportunities for advocacy. So 17 studies highlighted how the widespread nature of certain pandemic-related accommodations, such as the shift to remote work and the provision of adaptive technologies to facilitate work from home, lessened some of the stigma that these accommodations had been associated with prior to the pandemic. So one secondary analysis study, for example, observed that some workers with a disability who had prior accommodations for remote work reported a positive experience of working from home during lockdown because their colleagues were also working remotely. As a result, they were no longer singled out and stigmatized for this accommodation. Similarly, one researcher in a commentary explained how prior to the pandemic, academics with disabilities who were provided with adaptive technologies were constantly accused of receiving favorable treatment. But this argument became somewhat obsolete when these same technologies became widely used during the pandemic for online teaching and for online conferences. Now, 7 studies discussed how workplace changes implemented during the pandemic created new opportunities for advocacy around workplace accommodations. And there were basically 3 aspects to this. So the first was less bureaucracy. So while the process for obtaining accommodations before the pandemic had often been a long and a bureaucratic one, several studies argued that the pandemic demonstrated that some accommodations can be quickly and rather easily granted. For example, in the pre-pandemic era, working from home arrangements represented one of the most requested and most denied accommodations for workers with disabilities. Yet during the pandemic, as one researcher explained, quote, because everyone needed these changes, the historical hard nose quickly turned into, we could make that happen, a sentiment disabled people have been waiting to hear most of their lives, end quote. 4 studies focused on the future of universal design, reporting on that the reliance on certain technologies to facilitate widespread remote work provided real-world evidence of the benefits of universal design. And finally, 4 of the studies suggested that the experiences of the pandemic may affect the way that future courts rule on the issue of reasonable accommodations when it comes to remote work or remote teaching. So in terms of the second theme, 20 studies reported negative or potential negative impacts of workplace accommodations during the pandemic on people with disabilities. These included worsened physical and mental health and new accommodation needs. So focusing on the second subtheme today, a common finding among the studies in our review was that the pandemic-specific workplace changes themselves created new accommodation needs for workers with disabilities. For example, 12 studies discussed additional accommodations that were required due to the transition to remote work. These included ergonomic office furniture, adaptive home office equipment, and accessible communication devices. 3 studies reported that for at least some of these workers with disabilities, these additional requirements were not met. The third main theme, which we identified in 23 studies, was the need to take action on workplace accommodation issues in light of the pandemic. So most of these studies highlighted the need for revisiting current legislation and policies on workplace accommodations. Several papers argued that legislation making remote work permanently and universally available would reduce or eliminate the barriers that people with disabilities face when requesting work from home as an individual accommodation. For example, in one study based on secondary analysis, the authors cautioned that although the shift to working from home may have convinced some employers and employees of its benefits, legislation may be necessary to ensure this option remains available post-pandemic. They recommend that governments consider legislation such as Finland's Working Hours Act of 2020, which makes working from home a legal right for all employees. Another key subtheme was the importance of including the perspectives and experiences of workers with disabilities. So one study observed that current discussions about the future of work have primarily been led by think tanks, business groups, and consulting firms, and the authors caution against leaving out the perspectives of people with disabilities regarding how the new normal workplace should look in the post-pandemic world. In one study, the authors remarked that, quote, to remain consistent with the mantra, nothing about us without us, the voices and experiences of disabled people should be prioritized, end quote. The sentiment was echoed in 5 other studies in our review, and it sort of ties back to what I was mentioning earlier with the screening process, that we found so many quite interesting articles about the impact of pandemic-related work changes and about the future of work in the post-pandemic world. But so many of these studies just didn't have any consideration of people with disabilities. So the findings of our review demonstrate that the impact of pandemic-related work arrangements on people with disabilities has been mixed. At the same time, the message about their political and policy implications was more uniform across our reviewed studies. Overall, there was optimism that the experience of the pandemic has presented an opportunity for advocacy for people with disabilities with respect to workplace accommodations. Some of these studies argued that the swift implementation of accommodations like flexible location and hours at the onset of the pandemic serves as evidence of underlying ableist attitudes among some employers and governments who previously refused to provide these same accommodations on the basis of undue hardship. One of the long-term consequences of the pandemic may be that employers could have a harder time claiming undue hardship. On the other hand, it is important to caution that while some workplace accommodations, such as remote work, became widespread in the pandemic, they were not universal. As some of the studies in our review pointed out, certain sectors did not see this broad shift to remote work or related modifications, and many people with disabilities worked in these jobs, particularly in the service and blue-collar sectors. Therefore, while some observers have referred to the switch to remote work as a mass movement or a global experiment, these statements obviously do need to be qualified. So in terms of looking at what's next, well, one of the things I think this pandemic has taught many of us is about the unpredictability of pandemics. And it is important to acknowledge that the COVID-19 pandemic is not entirely over and that its full effects remain to be seen. So one of the interesting phenomena that would be worth following is the presence among the working population of long COVID, which may potentially become categorized as a disability. And efforts are already underway in some countries to draw attention to the need for workers experiencing long COVID to receive special accommodations. And future research could explore whether the new potential opportunities for advocacy identified in this review materialize and have any effects in this regard. And I should say, we've actually just completed a study where we asked youth and young adults about their experiences and perspectives in the later stages of the pandemic. And frankly, the optimism that was expressed in some of the papers in this review was not widely echoed, unfortunately, among our participants. So it's a bit of a wake-up call, I guess. Finally, more empirical research is needed to understand how workplace changes during the pandemic have impacted people with disabilities specifically, including comparing the experiences of people with different disability types, so that professionals in the field of rehabilitation can be better equipped to support those who have struggled with these changes and help those who have benefited make the most of their new working arrangements. Such information, coupled with advice and insight from people with lived experience with disability, will also be crucial for policy and other decision makers who want to ensure that the new normal in the post-pandemic workplace, whatever that does end up looking like, is more equitable and inclusive for people with disabilities. And these are our funders. And I think we're going to be leaving questions to the end. So thank you very much.
Thank you so much, Christina, for sharing that very important scoping review. It actually segues very perfectly into our second scoping review on remote work for people with disabilities. So I am going to invite Julia and Upasana to please share their screen and present their findings.
Today, we're presenting our research study, Remote Work Among People with Disabilities, a Scoping Review. This is a project being conducted in the Inclusive Design for Employment Access Social Innovation Laboratory with funding from Accessible Standards Canada at McMaster University. Presenting today will be Dr. Rebecca Gevirtz, Upasana Panda, and myself, Julia Holmes. We are a multidisciplinary research team with collective knowledge and expertise in disability management, rehabilitation sciences, economics, human resource management, and chronic disease management. Our team consists of senior, mid-career, and early career researchers, as well as trainees who will work together within this mixed method partner engaged project. Our partners are national disability organizations with extensive experiences engaging with our research team. So our study is guided by the scoping review process by Arksey and O'Malley, advanced by Levac, Colquhoun, and O'Brien, and tools from the Joanna Briggs Institute. We identified our research question as, what do we know about the experience of remote work among people with disabilities? And the definition of remote work that we are using is types of decentralized work arrangements that would traditionally be done in a formal workplace, including those that focus on home and other non-workplace settings. So for example, work from anywhere. Next, we identified sub-questions we were interested in exploring, including how has the literature on remote work among people with disabilities changed since the pandemic? How does remote work address or create barriers to employment for people with disabilities? How does remote work among people with disabilities impact peer support, collaboration, and communication? How does remote work impact productivity and career advancement for people with disabilities? And how do intersectional identities impact experiences with remote work among people with disabilities? So, for example, intersectional identities including gender, race, sexuality, and family status. In order to identify relevant studies, we looked at related fields and disciplines, including business and management, health and rehabilitation, disability and critical disability studies, economics and social sciences, critical race studies, women's studies, family studies, social work, and industrial relations. We consulted a library and information scientist at McMaster University to identify relevant databases and appropriate keywords to use in our searches. As a result, we ended up searching 10 multidisciplinary electronic databases, including Medline, CINAHL, Embase, Web of Science, Sociological Abstracts, Asia, Psych Info, Business Source Premier, Econ Lit, and ProQuest One Business. And I'll hand it over to Upasana.
Thank you, Julia. So just moving on to talk more about the scoping review study phase that we're in. We have 2 members of the research team that are independently reviewing and screening through the title and abstract process using Covidence. We do have reviewers meeting regularly to discuss any questions regarding the inclusion or exclusion of the articles based on the criteria and to make sure to refine the criteria as needed. We have searches on relevant Canadian government and non-governmental organizational websites that may produce evidence or research articles like in the gray literature that may be of interest to our topic as well. So we will be capturing that information too. Full text articles, once screened from the abstract process, will be ready, and 2 members of the team will be included for the full text analysis as well. So once we've completed the full text analysis, key data about the impact of remote work will be extracted as well as charted and summarized, as well as analysis using thematic analysis will be conducted to report the results to provide a synthesis of existing evidence on the impact of remote work, on the experiences and even quality of work from people with disabilities. So like Julia mentioned, we did search through 10 multidisciplinary databases as we wanted to keep our search inclusive rather than being exclusive, so as to not miss out on any important research based around our topic and to capture it from different industries as well. So we had a large number of data to work with. However, we are currently conducting the title and abstract screening as mentioned, so we cannot provide our specific themes or comment on specific themes and analysis of findings as of yet. However, we are excited to share some of the topics that we've come across during the screening process of the title and abstract screening process. So some of these topics seen during screening were how is remote work as an accommodation, seeing studies talk about remote work and its impact on health and well-being for people with disabilities, remote work and its impact on work opportunities for people with disabilities. And as mentioned, the COVID-19 pandemic, as mentioned by Christina as well, we did see an increase in opportunities for remote work, which may be helpful for people with disabilities, both during the pandemic as well as beyond. We also did notice some of the studies that talked about challenges existing to accessing and participating in remote work, as well as examining remote work from an intersectional perspective. We did also notice a couple of studies talk about legal or human resource issues related to the right to participate in remote work for people with disabilities as well. So in the next steps of the project, we are to conduct a survey with people with disabilities to understand the impact of remote and hybrid work arrangements on key workplace outcomes. So we are in the stage where we're currently developing the survey based on some of the preliminary findings that we find from the literature, and also examining perceived organizational support, burnout, as well as the concept of intent to stay. We will also be conducting in phases 3 and 4 a qualitative part of the study, which will be conducting interviews with diverse stakeholders and also an economic analysis of perceived costs and benefits. And from these findings, we will be able to develop a framework for remote work for people with disabilities in our ending phase of the study. So the exciting part to share is we would love for you guys to get in touch with us. And we do have we will be looking for some assistance, actually, circulating the surveys and recruiting participants for the second phase of our studies. So if you do want to get involved or are interested to help out, please do get in touch. We do have our contact information up here, Dr. Rebecca Gwert. So please feel free to email at this email anytime. And another exciting news is we do have the Inclusive Design for Employment Access idea SIL, which is Social Innovation Laboratory website, coming up soon as well. And overall, we're excited because we know we will produce important findings through this project, and we're looking forward to providing an update in the coming years to this DWC community as well. So I'm just going to hand it back to Sophie right now. Thank you.
Thank you so much, Upasana and Julia. Sorry about that little glitch there with the screen sharing. My laptop decided to do some funny things with the keys, but it happens. So I apologize for that. So thank you so much. We will be now moving on to our panel discussion portion of this session. I want to welcome Christina, Rebecca, and Mahadeo, who will be discussing some important topics in the context of remote work. So the way this is going to work is I will be reading out a prompt and I will invite you to share your thoughts and speak on the topic. So our first prompt is, based on the research and your own experience, what are key learnings that should be applied to the future of work for people with disabilities in a post-pandemic labor market? I'm going to start with inviting Mahadeo to share your thoughts.
Thank you very much, Sophie, and hello again, everybody. So CNIB has done a little bit of work in the context of understanding remote work for workers with disabilities and what remote work has been like during the pandemic. And as part of the collaboration with Rebecca's team, we're very happy to share those findings. And one of the things that I think I would actually start with is a bit of a commentary, and that is that what we've called remote work during the pandemic was a little bit less planned and a little bit more of the, okay, we're in lockdown, you need to work from home. Whatever you brought home the night before is how you're starting your experience working from home. And so I think it's just worth it to acknowledge that there were barriers that were experienced in the context of working from home or remote work during the pandemic. And a lot of those barriers for workers with vision loss, for example, workers with sight loss, actually had to do with the availability of technology and were they able to bring home things from their workplace in terms of assistive technology that they would have needed to do their work. And if they couldn't bring home those things, what were the immediate workarounds until they could get back into the offices to get those things? So I'm just going to acknowledge that you know, it wasn't exactly a controlled experiment that we had, and we didn't have the scenario where somebody was able to say, okay, I'm going to work from home remotely. Let's actually plan for that. Let's prepare for that. Let's make sure that the right technology is in place, the right internet access is in place, and so on and so forth. And because of that sort of I'm going to say rushed beginning, you know, lockdown influenced beginning. I think one of the other things that's become clear is that the perspective on and the attitude toward remote work has shifted rather interestingly over the past couple of years. And so if we ask the question, you know, what do you think about remote work in 2020 or 2021? We would have gotten one particular answer, and I think a lot of those answers would have been, you know, if we couldn't have done this, we wouldn't have been able to move the economy and keep things happening and so on and so forth. And if you were able to remotely work as a person with a disability, then you were able to actually keep your job, and that's a good thing. But now we're in a space where a lot of employers are attempting to go back to office, and what does going back to office look like and feel like, and how much of the lessons that we've learned from remote work are actually potentially being forgotten in the rush to go back, I think becomes an interesting subsidiary research question. And a lot of that, again, is because maybe we thought about it very differently in the beginning. We did it because we had to, right? And I think Christina made a comment about remote work being an accommodation, and my perspective is remote work is remote work. Remote work's not necessarily an accommodation. I think it's a different way of working, and so I wouldn't position it as a thing that's done from that you ask for it and therefore it's evaluated and undue hardship is applied and then you determine if you're going to get it, sort of thing. So I do want to think about remote work, not just from the perspective of is remote work a good thing, but also from the perspective of how over the past 3 years now has society have employers actually thought about remote work, period, because we need to take that into consideration as we do the research.
Thank you so much. That is very keen insight. I'm going to invite Christina. Do you have any comments or anything to build off of Mahadio's point?
All right, thank you. Yeah, that's really some really insightful points. I think the point that Mahadio was making about potential for losing the lessons of the pandemic. Again, I'm going to turn to the current research that we just concluded, where we asked youth and young adults, both with and without disabilities, about their experiences in these later stages of the pandemic. I don't like to say post-pandemic because I don't think we are post-pandemic, but that was something that really came up quite often, was that youth think that we have almost wasted an opportunity. And it was unfortunate to hear a lot of these youth thought that maybe something more was going to come from the last 2 years, that a lot more lessons would be learned about the need for, first of all, the potential for people to be able to work in different working arrangements and still be productive and still contribute. And the fact that in a lot of cases they've been mandated back to work, it's really unfortunate because, as I said, several of them explicitly said that they felt that we have lost an opportunity now to really rethink the way that we work.
Thank you so much. And Rebecca, do you have any closing or building comments?
Yeah, perhaps I'll just add that in some of the past research that we have done, and this research was specifically through the Mental Health Commission of Canada, and we focused on people living with mental illness. But one of the findings out of that work was how important flexibility is in creating healthy and inclusive workplaces. So building off of what Mahadio and Christina have shared about the risk of sort of losing this or missing this opportunity, for me, the big takeaway that I'm hearing in the research to date is, that actually a lot of accommodations that in the past were seen as difficult and often denied actually can be done, and that there's more opportunity to create that flexibility, and that we should really leverage that we have in many cases the technology for a lot of jobs to be done in ways that work best for the individual worker, and that is really exciting. That's not to say that every job has every opportunity for flexibility, but there's a lot more flexibility than we had ever thought there was, I think. And being able to frame it as flexibility and ensure that we continue that learning of how flexible we actually can be, to me is very important and grounded in our evidence.
Thank you so much to all of you. We'll go on to our second question. The second question is, what future research and action is needed to further our capacity to build inclusive and accessible workplaces? I'm going to invite Christina to start this one.
Hi again. Well, again, I think one thing that we learned from our scoping review was that I was actually quite surprised at how relatively few studies actually explored the lived experiences of people with different disabilities during the pandemic. So it's good to see that the other scoping review is actually hopefully going to have a lot more findings in that regard, and it's also being done at a later stage, which is great. But also, I think it was interesting how few of the studies that we found spoke again about youth and young adults who, in a lot of the research, clearly have been really impacted by the pandemic in terms of altered career trajectories, in terms of their education. So I think that it's really important for us to speak directly to them, and particularly to youth with disabilities who, in our own research, we've found have so much to say, and they're concerned that they have no one who wants to listen. So certainly I think bringing in the voices and perspectives of youth with disabilities is going to be really important, because they have been really severely and in many ways negatively impacted, particularly in the area of employment.
Thank you. That's an interesting perspective. I'm going to invite Mahadio to comment or build off of Christina's point.
Thanks very much, Sophie. And I'm going to go in a slightly different direction. I'm going to say I think we need to take full advantage of the opportunity that is available to us right now in this moment in history, and that is actually understand what we mean when we say work. And for that matter, what we mean when we say workplace, what we mean when we say work environment. My project manager on the employment technical committee for Accessibility Standards Canada reminded me last week that workplace is a physical environment, but the work environment is over and above the physical space or the virtual space. It's what one does within that setting. And the other thing too is how much of work is the technical thing in the job description, the tasks that have to be performed, versus the collaboration that goes on, the quasi-social setting of an office, or the quasi-social setting of a team, or the quasi-social setting of any kind of environment where you're physically doing something, right? Or engaging in whatever it is you're doing with other human beings, right? So I actually really wonder if it's not the time to actually say, you know what, work is what work is, and remote work is this thing that we did during the pandemic. But what if we were to go through an exercise where we put all of that to one side, and we actually went through a design process where we said, what happens if we actually design this from the ground up? What happens if we think about this and conceive of this in ways that we have perhaps not done before? And if we said, let's not be beholden to the way that we've done work for the past 150 years, but rather let's actually think about what work can be, given that we have technology that we didn't have 150 years ago, and the pandemic's taught us things that hopefully we won't forget that we didn't know 150 years ago. And it's a very different world today than 150 years ago. What would work actually be like if we were to design it in an inclusive and accessible way today? And I think that's a piece of research that can't just be done by one group. It's a piece of research that needs to be done by a lot of people together. And I think to the point that Christina made earlier also about who's actually talking about the future of work, think tanks are talking about the future of work. But that needs to be a conversation that is inclusive, that starts at a grassroots level, that includes persons with disabilities, that includes newcomers, includes persons who speak languages other than English, includes all people in the space, not just those of us who are acknowledged experts in the space.
Thank you so much. And Rebecca, is there any final comments on this prompt that you would like to share?
Yeah, it's interesting, Mahadi. Your comments are making me reflect. I was going to comment on that. I think we need to examine some of the challenges that are created when we think about flexibility, when we think about remote work. Often I think we have focused on what is added, but we also need to think about, like, what are people losing when they aren't connecting in the way they have in the past, and what's lost, Can that be regained in some other alternative way? Does it impact people's career pathways in either positive or so really exploding that what happens when we talk about flexibility and different ways of connecting. But I think Mahadio's point is actually perhaps the way to go is to actually sort of step back and say, how, like, let's redesign this. Let's think about what we have today and what we'll have in the future, and be really open to, you know, what that could look like. I think that actually maybe is a better way to approach it, rather than focusing on the challenges, to really examine those solutions and really bring it together from a multidisciplinary perspective, and try to think outside the box, that it doesn't have to be the way we've always done it. So I really appreciate those comments, both Christina and Mahadio.
Thank you so much, Rebecca. That concludes our time for the panel discussion, but I do quickly want to ask Christina and Mahadio and Rebecca, you as well, if any of you have any final closing remarks that you would like to say about this topic before we move on to the question and answer portion of the session. So I will give the floor to Mahadio first. If you'd like
Thanks.
to speak.
Yeah, thank you, Sophie. I'm going to keep this really brief. I think one of the things in particular about remote work or work from home during the pandemic that we learned in the research that CNIB's research team undertook as part of its ASC funded Inclusive Workplaces project, that sort of really provides a neat dovetail between the work that Rebecca and your team are doing and the work that we've done at CNIB. If we imagine a person with sensory disabilities in the workplace, that individual, as do all individuals, connect into the workplace through being in the same place at the same time as other people, being able to be spontaneous and interact with people in a collaborative and spontaneous way, and also having access to sensory input because of the environment that they're in. Remote work does the same thing for everybody at large that living with a sensory disability actually leads to in the context of an in-person work environment. And when I actually realized that, and that was an insight that I got after supervising a student, Erin Lee from OCAD University, alongside Dr. Peter Coppin, who's an associate professor at OCAD. I suddenly realized that one of the things the pandemic did was it actually put everybody within a space that was akin to and relevant to persons with disabilities experiences, which is probably one reason why everybody wants to go back to the way things were, because people are afraid of the experience that they had and the things that they were missing, which some of us with sensory disabilities have never had in the first place. And I think if we can think about work in that kind of context, we're gonna do lots of wonderful and interesting things. And so I'm just gonna put that as a bit of a mind warp for the audience, and then settle down and wait for the questions.
Thank you so much. Christina, do you have anything to follow that? Any final remarks or closing statements?
You know what, I think Mahadio and Rebecca both made some really beautiful points there. So I'm going to leave it there. Thank you very much.
Amazing. Thank you. And finally, Rebecca, any quick closing statements or final remarks?
No, thank you. I look forward to the questions.
Amazing. Well, thank you so much to all of our panelists for sharing your thoughts and opinions.